just live streamed as well on YouTube. We'll get send link for you. I mean, you don't need it, but it's like before you want to see it. Yeah.
It's.
Go for it.
Like,
Awesome.
I mean,
Yeah.
what I've done.
Ours is here. Yeah. Perfect.
It's great.
Yeah, she is. She's awesome. Perfect. I think we can get
Let's
started.
go.
Yep. I think we can get started. It's our, hi everyone. Good morning. Perfect. Okay, so as everyone knows, thanks for making the time this morning and coming in person, and for everyone who's joining us virtually this morning. This is an amazing grand rounds. This morning we get to host Dr. Cook, Nikela Cook here, who's the executive director of the Patient Centered Outcomes Research Institute, or PCORI. She's a cardiologist and a.
So I wanted to introduce the introducer today, and No, he's got a lot of good stuff, so I'm going to let him go back. But I just want to let you know that we have the most extraordinary guest here today. When I saw that actually Nikela Cook had decided to come to our cardiology grand rounds, she's the executive director of the Patient Centered Outcomes Research Institute, PCORI, which distributes billions of dollars in research and focuses specifically on investing in communities and in people and creating research that is partnered. But I just wanted to preempt just for a second to say that, she's an extraordinary example of someone of immense talent, kindness, generosity, who took her career in a direction where she wanted to see others succeed. So when she was deciding on pathways after her cardiology fellowship, she ultimately decided to join NHLBI. And in a role in NHLBI, you don't often hear the names behind the scenes of people who are doing the funding. And yet they play such a critical role, not only in conceptualizing programs to be funded, but in reaching out and supporting investigators in ways that help them understand how to be successful and how to find pathways that can ultimately augment their contributions, put them in a position to actually generate knowledge that means something. And over a period of just a short period of time in NHLBI, up until the time she was really, what was the position with Gary? That was chief of staff and senior scientist to Gary Gibbons. Nikela became almost legendary within NHLBI in the ways in which she could help guide the program and support investigators and to conceptualize ways in which that investment, the investment that was being made there, could actually create a return for society. And there's a lot of creativity, but there's a lot of behind the scenes work, and it's not very glamorous, honestly. It's not the ones that get known, but Nikela sort of wound her way through that system and was remarkably successful. And then when PCORI was ready to make a transition from their first director, Joe Selby, to find who was going to lead them in the sort of this second tranche. The first one was about just establishing the legitimacy of PCORI. PCORI was an outgrowth of the Affordable Care Act. It was a question of how were this money that was going to be made available truly be differentiated from ARC and NHLBI and other ways. And they looked to see who might have the creativity and the generative nature to be able to take this to the next level through PCORI. And they made the most wonderful choice in selecting Nikela. And she has, since she's been there, really sort of laid this foundation for what PCORI can be going forward. And she has such immense admiration. I just wanted to inject this because, and then Rohan can give a 20-minute intro. But I just wanted to say thank you for coming. Our Grand Rounds it's a modest group. There are people listening, but know that we're all intently interested in what you've got to say, and so appreciative that you came. So thank you, Nikela.
Hard to top that. So, but out of just, routine, I do want to make sure that I share some of the background Dr. Cook has had. So she's a fellow cardiologist, as I mentioned, and a health services researcher. And that's really important that she was a practicing cardiology at the Washington Hospital Center when she was at NHLBI. Before that, she did her college at UAB and her MD at Harvard Medical School. At Harvard School of Public Health, she did a master's in public health with a focus in health policy. And she's led, of course, I only have a passive view as a reader of the literature that, an interest in focusing on multiple stakeholders, including patients, clinicians, and everybody who's important for the research enterprise to be a part of this infrastructure. And we're so privileged to have you here again. And thanks so much for being here. Thank you.
Right.
Well, thank you so much. It's going to be difficult to top the introduction with the Grand Rounds talk. And I feel so fortunate to be here. It, in many ways, feels like I have an opportunity to come to a second home. I see so many familiar faces in the audience and opportunity to reconnect with people. And this is just a wonderful time to be here. So I thought I'd tell you a little bit about what we're doing at PCORI, and that's why I titled this talk, Driving Toward Health Impact, Our Journey and Our Path Forward. So I'll tell you a little bit about the journey to how we've gotten to where we are and what we're thinking about in the future. I am also, really pleased to share the fact that PCORI and Yale really do have a history of collaboration. You heard from Harlan this morning, who was one of our founding board members and one of the key influences on thinking about PCORI as a patient-centered organization and what that really meant. We often talk about what's in a name, and he helped us define what's in that name. We've also had a long collaboration with the Yale Clinical Scholars Program, where we have the opportunity to meet with the fellows and scholars every year. And I've had that fortune of meeting with them with Joe, and I appreciate that opportunity on an annual basis. But we also share a lot from the funding of awards. And you may not know that more than $60 million of PCORI funding has come through Yale or to Yale. And you see just a snapshot of a few of the sample PCORI funded awards here. And I just wanted to mention that, we've funded engagement award projects, which we'll talk a little bit more about, but those actually help us in thinking about how we build capacity, how might we overcome some of the challenges of doing multi-stakeholder research. And the one that's highlighted here really engaged vulnerable communities of color around the Yale New Haven Hospital in order to deal with some of the challenges of having them involved in research at the hospital and how to translate priorities in a way that really resonated with the community. And you can also see that we have a recently funded project highlighted here that is really about an approach to thinking about how we foster the consideration of social determinants of health and thinking about addressing inequities and hypertension control. And I had the privilege of hearing more about that directly from Erica Spotts last night, and am excited about that work moving forward. So just quickly, from a learning objective perspective, I hope that you walk away feeling that you understand the mission of PCORI, our new directions and our national priorities for health, and how an evolving health and healthcare landscape is informing our new directions. So I'll talk a little bit about our history and where we've been, a little about PCORI and the ecosystem that it sits within, that larger research ecosystem, and how our focus is unique in that research ecosystem. I'll also talk a little bit about the evolving healthcare landscape and some of the things that we've really noted over time that were important to consider as we set our vision for the future. And it's going to be critically important that as part of that, we talk about health equity, because it's so much a central part of what we think about on a daily basis at PCORI. And you'll hear a little bit about our journey ahead and where we're going next with a lot of our work. So for those of you that are familiar with PCORI, this may be a familiar territory, but others may not be familiar with the fact that we're an independent, not-for-profit institute that was established in 2010, but are funded through federal dollars. And the goal really was to advance patient-centered care and healthcare delivery. And you can see here our mission. It's pretty simple, but I think it's a really powerful one. PCORI really aims to help people make informed healthcare decisions and also improve healthcare delivery through the generation of information that's evidence-based. And this is the key. It's about research that's guided by patients, caregivers, and the broader healthcare community. And we think that sets us apart in the research ecosystem. We have this unique role of making sure that we're engaging patients, clinicians, and those who we desire to benefit from the research that we fund in all aspects of our work. We do this really through clinical comparative effectiveness research. That's the mandate for PCORI. And when we talk about clinical comparative effectiveness research, or CER, we're really talking about generating that evidence that's comparing the benefits and harms of at least two different treatment strategies or methods to prevent, diagnose, monitor clinical conditions or improve care delivery. And that's that care delivery science that we also fund. And we're really interested in real world populations. And we recognize that a lot of the clinical trials that are designed to basically prove efficacy are done in narrow populations because of the inclusion and exclusion criteria. They're really designed to prove an effect. And what we're interested in is taking that to the effectiveness studies that engage the real world populations for generalizability and broader reach. We also are committed to describing results in subgroups. And so we have an emphasis in our methodology standards that really form the basis of what the type of research that comes to PCORI must include. And that emphasis really relates to things like heterogeneity of treatment effects and subgroup analyses that will help really inform the research towards specific populations in terms of thinking about what works best for specific groups in certain circumstances. And as I mentioned, one of our primary goals and part of our mission is to help clinicians, consumers, purchasers, and policymakers really have the information they need for informed decision-making. And so we hope that most of our work is helping to inform either a specific clinical or policy decision. Engagement is really at the heart of what we do at PCORI. And so what I have before you is a kind of rubric that we use to talk about engagement and research. And when we talk about engagement, it's really that art and science of bringing together those who are really important in the work that we do and understanding what's important to them and how to make sure that the work actually generates the results that's going to be meaningful to them. And you can see here that when we talk about engagement, we're talking about identifying the areas of focus that we'll have in our research that we fund, even planning studies and designing them in ways that are going to benefit the populations the most. And we involve stakeholders in the review of applications, as well as in thinking about conducting the study itself and participating in the research and participating in what we call our peer review process, which is a process that comes after research results are ready for publication. And it's a process that really allows us to go through something you may be familiar with in journals in order to make sure that the research results, when published on our website, actually have that rigor and understanding for those that are desired to see those outcomes. We also engage patients and other stakeholders in the dissemination and implementation of research results from PCORI funded studies. And so we take that work all the way across the finish line and work with our stakeholders throughout the process. And truly, we believe that the voices and the lived experiences of patients and others make this work unique and make sure that we're studying the issues that are most important to them and will benefit them. At the bottom of this slide, you see about 6 different key principles that we've determined are essential for effective engagement in research. And you can see one of them is labeled reciprocal relationships. And that's really when the roles and the decision-making are defined collaboratively and really are clearly stated. And that's where we find this important component of having equal partnerships in research, and that authority has to be equal amongst the stakeholders and the researchers involved. You see another principle here around co-learning regarding the research process and patient-centeredness, because both stakeholders and researchers may be new to this type of work and have to understand a bit of how this works. And there's a co-learning component that's critical for engagement. Partnership, trust, transparency, and honesty are a few other key principles that have really come through the engagement work that we've learned quite a bit about. And we understand that these are really enhanced when decisions are made inclusively and when the information is steadily shared with all of the research partners. So we've learned a lot about engagement over the past 12 years or so. And I wanted to just mention that some of these things that we've learned are also quite helpful when we start to think about health equity. And we'll come back to this when we get to that section of the talk. But one of the things that you see here is that engagement actually facilitates recruitment and retention overall. So when we hear people asking us, how can we engage certain populations that we think are critical to really have inclusive science and inclusivity in our research, well, we think of engagement as a tool toward that end. We've also learned that it's really never too late to start engaging communities, patients, and stakeholders in research. We'd all like to think about it earlier in our processes and make sure we're doing it from the beginning, and that's the ideal. But we even hear from PIs and investigators in this work that even if they didn't do it until later on in the study, they're so grateful that they did because of how it actually changes the way in which the study may be designed, the way it's received, and other things that have been critical to the participation of participants in the research study. So we always say there could be reasons why it doesn't start on time, but never forget to do it. It's never too late. And very often we found that trust and trustworthiness are essential components for effective partnerships, and they're not the same thing. So often we can build trust, but trustworthiness is something that people want to see that shows up on a regular basis and is there as something that is really meaningful to the work that they're willing to participate in. And one of the things that we found is that trust and trustworthiness can also be facilitated when you utilize those that are trusted in the community to participate in the work that you're trying to do. So meeting populations where they are and facilitating that with community brokers or those that have the trust of the community is another component that we've learned about really engaging those that we desire to reach. So I thought I'd mention that, engagement in research and multi-stakeholder research is not easy. It comes with challenges. There are a lot of challenges around balancing priorities, around understanding what reciprocal relationships are really about, what co-learning is really about. And so we've actually come up with several different modules to try to help investigators, community members, and patients to be involved in the research in a way that's really meaningful. And you can see here, we have a research fundamentals course that's really designed for those in the community to understand kind of the fundamentals of research processes and CER. We also have modules on building effective research teams, and these are multi-stakeholder research teams. So understanding how to balance priorities, especially if they're different amongst researchers and communities. And we have a repository of tools and resources that actually are generated from funded PCORI work. So when we have investigators and teams that have created tools for engagement, we then include them in this repository so that others can utilize that as a resource and go to it when they're trying to think about their approach in their projects. But I thought it was really important to mention that there's a lot of work that we still need to do to really bring a rigor to the engagement process and develop a more systematic approach. And so we've recently launched something that we call our Science of Engagement Initiative. And this initiative is designed to fund studies that actually will bring a new level of rigor to closing some of those evidence gaps about what works and doesn't work in engagement and research. And the first thing that we're going to be doing under this initiative is developing and validating different measurement instruments that'll help us capture important elements of engagement, like the structure and the process and the context and the outcomes of engaging in research. And then we're going to evaluate methods of engagement within several of the studies. And these are the different approaches that research teams may be taking to engage community partners. So look forward to some outcomes of that work, which I think will be really important for those that may be first undertaking the type of research that PCORI funds. So just to bring you up to date with where we are with our portfolio, we've funded about $4 billion worth of awards thus far. Across more than 2,000 projects, both research projects and research-related projects. And when we talk about research projects, this is the majority of that funding. That's comparative clinical effectiveness research. But when we talk about research-related projects, that's where we talk about the type of work that's really necessary to support patient-centered outcomes research. So engagement awards that help build capacity in communities and with patient organizations to engage in research. That helps with the dissemination and implementation of research result findings. We also have dissemination and implementation awards, and those really are about bringing results to scale or thinking about different settings from a research finding. And we have infrastructure awards as well that relate to our methods portfolio. We're one of the few funders that fund methods research, particularly related to comparative effectiveness research and the different types of challenges that we see in that work. And our PCOR infrastructure awards also include the funding of PCORnet, which we'll talk about shortly as well. So I thought you'd be interested in seeing just the number of studies by condition. And this actually gives you a snapshot of where most of PCORI's funded research resides. And you can see the top 14 health conditions and areas of funding here on this slide. And by far, mental and behavioral health is the area in which we fund the most. But you can see not far behind are both cancer and cardiovascular diseases. And we're continuing to build that portfolio. So I wanted to give you a little bit of a snapshot related to cardiovascular health and the portfolio that you see here. We have a lot of activity in this area. We funded several engagement awards, and these, as I mentioned, are designed to really help stakeholders pull together convenings or capacity build to engage in CER. But the majority of the funding here relates to CER awards in the cardiovascular health portfolio. And here you can also see that there have been multiple collaborations with organizations like the American Heart Association, AHRQ, and NHLBI on these types of awards. But 70% of them come from what we call our broad funding announcements, which are open announcements with no specific area of focus other than aligning with our national priorities. And you'll see that coming up soon. You can also see across the care continuum that the majority of the studies in the cardiovascular health portfolio relate to treatment, and there are others that are here related to prevention and screening. But what you'll hear a little bit in terms of our thinking forward is the importance of some of that prevention work and primordial prevention type work. And you can see amongst the conditions that it's really spread in the cardiovascular arena. So I thought it'd be fun just to highlight a few of the awards that we've recently funded in our cardiovascular health portfolio. And you'll see that here all the focus is on the comparison or comparing of different interventions or approaches due to the nature of CER. And one that we're also very excited about, the Live Better Award that you see here, which is currently just about to start recruiting patients, if I understand correctly from the update I heard last night. So I thought for this audience, you may be interested in taking a look at what we offer in terms of PCORI funding opportunities. And in our research opportunities, the majority of the funding that we distribute comes through targeted research opportunities. These are actually those stakeholder-driven topics that may have come through either our engagement awards for the research agenda that we're setting, or even from the convenings and other types of activities we do to understand what's most important to patients at this point in time. And we'll be talking a little bit about where we are with some of those topics shortly. We also have a broad pragmatic studies announcement, and this is one of those open to investigator and research team initiated ideas. And as I mentioned, the national priority area is the only important area of focus within these broad pragmatic studies, and proposals range from up to 5 million or 10 million. It's a step function in terms of the type of award you may be seeking. And our larger awards are our phase clinical trial awards, and these are up to about 22 million. And these are the opportunity for some of those higher impact CER trials that we really are encouraging, and the utilization of PCORnet that we encourage with that program. You see the research related projects that I mentioned under the bottom here, and those award announcements also come out on a regular basis related to things like methods work, engagement projects, and dissemination and implementation awards. And we often see investigators that have finished a research award then apply for a dissemination and implementation project to take that work into the clinic, near practice, or even to scale it up within hospital systems. Another unique component of PCORI's approach is that we actually have a commitment to getting the results of studies back to patients and into the public domain much faster than simple publication alone. And I shouldn't say simple publication because publication is complicated. But so we actually provide funding to research teams to return research results to patients and to those that have participated in the research study. And we also make sure that research results are published on our website as research findings and abstracts, as well as in these full final research reports that can be up to 3 to 5 journal articles and links. So they're pretty complex and comprehensive. And that's where our peer review process comes into play to review those before they're actually posted. And you can see this slide actually shows that the process actually provides research results earlier in the public domain as compared to publication alone. And that's the purple line, which is elevated and bent to the left as compared to the PCORI research results publications in the blue dotted line. And then if you compare that to the benchmark, it's even higher than that of the benchmark of non-PCORI funded publications. So almost 60% of PCORI trials have published preliminary findings by 30 months, and that's that blue line, which is also half the time of the benchmark in the orange color. And if we include the results on the PCORI website, you can see that this increases to nearly 100%. So we continue to see PCORI funded results coming to fruition, and there are a few that I highlight here. And, I mentioned the adaptable study here because it was a large trial that many of you know about with over 15,000 people with cardiovascular disease that compared 81 milligrams of aspirin to 325 milligrams of aspirin and had a traditional MACE outcome. But what was really of interest in this trial was the ability of the trialists to conduct a trial at this scale, leveraging digital strategies in the electronic health record system. And that really proves the ability to do that within this network of networks, PCORnet, that we think can be leveraged for future trials and studies. I'll also mention the Prevent Clot study, which was recently published and compared aspirin to low molecular weight heparin for patients receiving treatment in a trauma center for either lower extremity fracture or pelvic fracture. And aspirin was found to be non-inferior to low molecular weight heparin. And this study has already had uptake and up to date as an option, an alternative for low molecular weight heparin in select low-risk patients who are undergoing surgery for lower extremity trauma. So we're excited about seeing some of the momentum of activity moving into clinical decision tools. But I also thought that it was nice to highlight the iDecide LVAD trial, which was basically a trial focused on shared decision-making. And what was really interesting about this study is that the tool that was utilized in this trial was then moved on to a dissemination and implementation project, which allowed for that scale up and spread in other health systems. So it's just an example of what I was mentioning in terms of the ability to take results across the finish line. So I'm going to transition a bit and talk a little bit about our evolving health and healthcare landscape and how it's informing the way we're thinking about our next phase at PCORI. And, one of the things that I think is really critical is that for us to really envision this future of PCORI's work, we have to be aligned with the evolution of the health and healthcare landscape in a way that we can think about how to elevate that to patient and community-centered approaches in terms of thinking about interventions. So, really our opportunities for the future are going to stem from this alignment with health and healthcare landscape and the emerging innovations that are occurring, including things like big data and artificial intelligence, machine learning. And we were talking about chatbots last night that are recognizing opportunities that were being leveraged for real actionable information in healthcare in this current environment. Digital health, of course, is another component with all of the wearables and types of apps and things of that nature that patients have access to at this point in time. And then that ability in terms of precision medicine, I think that represents this integration of clinical genomic and other types of data that we can really consider, as well as the social determinants of health data that's coming to the fore. And PCORI's opportunity is really about leveraging these innovations to think about the patient-centered and community-centered approaches that may be important to consider for research in healthcare in general. So a good place to start really is the way we think about this virtual cycle of our approach, which is a cycle of evidence to implementation, where research that really focuses on the questions that are important to patients generates the evidence in a way that is perhaps even fully or more integrated with health and healthcare systems and care delivery that leverages the data and technology that's there and improves healthcare outcomes, which could actually generate new research questions in this kind of virtuous cycle. And we believe that this type of cycle actually accelerates progress toward an integrated learning health system. And note I mentioned health system and not healthcare system, because the health system is something that's going to center around a patient or an individual, as opposed to the care interaction that may be in the clinic or hospital setting. And there are a lot of drivers of that health system for an individual. And this is actually one of our national priorities for health that I'll mention, this idea of accelerating a learning health system. And that learning health system, I think, in that virtuous health cycle also links together nicely three of the major funding initiatives that are happening at PCORI right now. One I've referred to relates to PCORnet, which is the National Patient-Centered Clinical Research Network. And it's a network of networks that's really designed to bring together data, health data, as well as patient partnership and the research expertise for both observational and clinical trials that can deliver really more fast, efficient, and trustworthy answers that'll help to answer health dilemmas. And the implementation piece, which you see on the right, relates to a recent initiative called the Health Systems Implementation Initiative. It's a new program that we just launched, where we've brought 42 health systems in partnership with PCORI to start to think about how we might leverage the expertise and knowledge they have about their communities and systems to advance PCORI research results into implementation in those systems. We're very excited about this initiative. And finally, in the middle of the slide, you see that key component of any learning health system, and that's the research workforce. And we talk about the workforce as a PCOR workforce, patient-centered outcomes research workforce, because it's more than the academic institution, it's the community, it's the patient partners, it's the stakeholders that are engaged. But there are two components related to our workforce activities that I'll highlight shortly that we're funding in relationship with AHRQ. So the first element that I mentioned is PCORnet, and I just wanted to give you a little bit more information on PCORnet here. It's really meant to be a national resource that will help with the conduct of research in a faster and easier way than traditional randomized clinical trials. And PCORnet's doing this through providing access to data and patients, and really had the opportunity, I think, to test a lot of the structure and infrastructure during COVID-19. And now the principles that are driving the utilization of PCORnet is that it's ready for studies of scale and scope on a national scale. You can see here that there are 40 participating health systems, about 66 million electronic health records, and more than 30 million patient encounters for clinical trial recruitment. And we really believe that the time is right to use the network in ways that will facilitate the outcomes of the questions that are on the minds of patients and health systems. I mentioned to you as part of that virtuous cycle in the implementation phase that one key example is the Health Systems Implementation Initiative. And we're very excited about this program, which we think could be potentially groundbreaking. And while we have 42 participating health systems, you can see the reach here of over 145,000 hospital beds, 79 million unique patients, and 41 states plus the District of Columbia. And in partnership, this group is really diverse and remarkable. It has safety net systems, academic health systems, rural, urban populations, and so many different patient populations across the country. And this is an activity that has just launched. We had a learning network that's part of this, where all the health systems actually are learning from each other. And right now they're actually submitting to PCORI for capacity building projects that will facilitate the integration into workflows for some of the research results implementation that will be coming next. I also mentioned that there are two activities that we've been supporting with AHRQ to think about how we leverage health systems to really build the capacity for our workforce. And the first is this institutional mentor career development program. It was a traditional K-12 program that was supported by AHRQ, and it established 11 centers of excellence in learning health centers research training. And as you can see here, there were over $40 million of K-12 grants over 5 years, and that's coming to a close in 2023. And so what we've put forward is that next step of the program, which is called the E-STAR Centers program, which is really working on the professional development of scientists to conduct patient-centered outcomes research within health systems. And so this actually has more research funding while also building that training component for a lot of the investigators that are interested in figuring out how to do this health systems work. There's an emphasis on enhancing diversity and inclusion within this program as well. So the landscape of really thinking about the health and healthcare landscape that informs PCORI's future opportunities is really informed by what we've been seeing and learning from the pandemic. A lot of the work that we now are recognizing will be critical to health equity activities moving forward. And it would be remiss if I didn't talk about this as part of the national landscape. And we all acknowledge that we've had remarkable progress over the years in research and innovation. But despite these advances, we know that disparities and inequities still remain. And the latest update that many of you may have seen on heart disease and stroke statistics that were published earlier this year show us basically that cardiovascular related deaths have been on the rise for the past 10 years or so, after a steady decline really since the late 1960s. And if you look specifically at the year 2020, the first year of the COVID-19 pandemic, more people died of cardiovascular disease in 2020 than in any year since 2003. But we also saw age-adjusted mortality rate going up by about 4.5%. But what's really significant within this to me is that the largest increase in deaths we're seeing amongst Asian, Black, and Hispanic people, which really highlights a lot of the structural disparities that we see in this country. And I was also very struck by this publication a few years ago related to hypertension as being a compelling example really of the type of disparities and inequities that we see. And I was simply blown away by this curve, which essentially shows us as analysis of age-adjusted proportion of adults with hypertension and controlled blood pressure. And the study highlighted basically that the increase in blood pressure control there was an increase in blood pressure control followed by this leveling off and then this steady decline that you can see over the last 2 years of the study. And a major driver of that ability to have blood pressure control was having a healthcare visit within the last year. And there were remarkable disparities in hypertension control by race in this study as well. And as someone who was very involved with a lot of the hypertension studies at the NHLBI and even the SPRINT trial at the time and the subsequent recommendations around thinking about lower systolic blood pressure targets, it just reminds me how much we have to double down if we're even going to get control at the levels that we previously thought were adequate in certain populations and really focus on eliminating the persistent disparities gaps. So I want to take you back a few years and think about 1985, where Secretary Margaret Heckler actually talked about a stubborn disparity, and she called it an affront, both to our ideals and to the ongoing genius of American medicine. And I take that as something that means I have a personal responsibility as a physician to think about how we handle these issues in our daily work, as well as a researcher. And 18 years later, in 2003, a well-known report from the Institute of Medicine called Unequal Treatment actually talked about race and ethnicity remaining significant predictors of the quality of healthcare received 18 years after Margaret Heckler's report. And then let's fast forward another 18 years, and we're in the middle of the COVID-19 pandemic, and it made it painfully obvious that these stubborn disparities still remain. So what is it that we're not doing that we have to do differently in both our research as well as our healthcare delivery to really make a difference? And one of the things that we've been talking about at PCORI is this advancement of the addressing or mitigating disparities to thinking about a framework of health equity as a way in which we are doubling down on our efforts. And at PCORI, our strategy, which we'll talk about momentarily, actually includes a bold statement of achieve health equity as part of consideration for the research that we fund. And I like this definition from the CDC because it's simple, it's easy for us to remember, but it's really about health equity being when everyone has the opportunity to attain their full health potential and no one's disadvantaged from achieving it because of socially determined circumstances. And I tend to think about patient-centered research as having almost an inherent focus on health equity because it involves taking into account all the voices and the lived experiences of all who are involved in the research. Over the years at PCORI, we've really funded a number of studies that have explored innovative solutions to eliminating disparities. You see here interventions related to workforce deployment with community health workers, or comparing different delivery models, or even examining different organizational policies, or community engagement activities, or clinical interventions that may focus on specific populations, and also technological approaches. But I think as we start to move forward, what we're learning is the importance of inclusivity in the work, as well as the way in which we fund opportunities that really bring certain vulnerable populations into that partnership with researchers. And so we're looking forward to innovative opportunities to make progress on our strategic priority related to health equity. And we just recently introduced the supplemental funding for eligible projects to really focus in on thinking about how they might increase diversity in the patient populations or research populations that they're seeking to enroll, as well as making a health equity impact. And we're really excited about this work because we think we're going to learn in a way that will allow us to start embedding equity science more into our framework. We also have recently released something called a partner funding opportunity, where we're really positioning community organizations as full partners alongside research organizations, both in the shared responsibility and fiduciary responsibilities of the award, but also in that full intellectual partnership. And this actual funding opportunity focuses on something else that's a little unique as well, which is interventions that are multi-component, that have an intervention focused on the clinical outcome of interest as well as the social determinants of health. And so we'll learn a lot about how these multi-component interventions work in comparative effectiveness research as well. So I want to just transition here to talk about where we're going and think about the journey ahead, and mention our new strategic plan, which many of you may have seen. We began a strategic planning process about 2 years ago. And we knew that envisioning PCORI's next phase really was going to require us taking that broader look at the health and healthcare and research landscape. And it resulted in this new strategy, which centers really at its core around 5 national priorities for health. And you can see them here on the left side of the slide. These are considered ambitious and long-term goals for PCORI that will help guide the way we fund our research, as well as the other initiatives related to engagement, dissemination, and infrastructure. So I wanted to just talk briefly about the 5 national priorities. And the first is increasing evidence for existing interventions and emerging innovations in health. And this priority was meant to recognize that lots of new technological advances, drugs, therapeutics, et cetera, that are being approved on the market actually have a need for us to go back and compare to existing interventions, and that there's an opportunity for PCORI to accelerate more of this work in our future. We also recognize that we need to enhance that infrastructure and accelerate that infrastructure for patient-centered outcomes research. And we talked a little bit about some of the things that that requires in terms of thinking about not just the research data and technology, but also the people and the systems that support that. You see here a priority around advancing the science of dissemination, implementation, and health communication. And we've long had a focus around some of the communication science and implementation science, but we see an opportunity to really take that a step further and build that portfolio. You see that boldly stated priority around achieve health equity, which stands alone, but also undergirds all the other national priorities. And then one around accelerating progress toward an integrated learning health system, which we talked about a little bit previously. Now, these are in a circle for a reason, because they're designed to reinforce and really work synergistically, and they're not standalone in any way, shape, or form. But on the right, you see our holistic approach to thinking about how we advance these national priorities. And really, we have to work together with the CER that we fund, the engagement, the infrastructure, and the dissemination and implementation if we want to advance those national priorities for health. So when we went through this very stakeholder engaged process to develop that strategic plan and those national priorities, we also got a lot of granular input on topics of interest to our stakeholder community. And we took that and developed what you see here as a set of broad topic themes that are really going to be basically embedded in our funding opportunities over the next funding cycles, or in that first launch from the strategic plan into our next funding opportunities. And these focus around populations and health behaviors and health conditions. And there's a specific focus around improving cardiovascular health. So I wanted to talk about that a little bit as well. So you saw that topic theme included improving cardiovascular health. And this is a critical area of focus for PCORI stakeholders. We hear about it in many different scenarios and settings. And unfortunately, as we also talked about, remains the leading cause of death in the United States. And that we recognize the really disproportionate impact in terms of disparities and the determinants of health that influence individuals in this with this health condition. But what I think is really some common themes that we've heard from our stakeholders is that there's an abundance of evidence out there. We've been great as cardiologists in generating a lot of evidence-based care options, but many of them are incredibly underutilized. And when you start to look at specific populations, the underutilization is really embarrassing at times. And second, we have recognized that there can be a limited incorporation of patient health goals into practice. And how is it that we can start to really enhance that understanding of patient health goals in a way that can inform practice. And some populations, as we talked about, remain persistently underrepresented, even in pivotal trials. So we don't know the generalizability and applicability of those studies to them. And we recognize that patient-centered strategies to improve medication adherence is still quite critical. And this is something we also have heard from our stakeholders. And finally, when we look at that care continuum, the other thing that we consistently are hearing is that we've put a lot of efforts in the targeting treatment, but maybe more needs to be placed in upstream and prevention, if not more as much as what we're thinking about in the treatment realm. So I think the stakeholder interests here really align with several things that we see as important at PCORI. And so looking ahead now, we can see many areas that PCORI actually could make significant contributions in cardiovascular health. And you can see starting at the right hand of this care continuum under the secondary prevention, that many stakeholders have specifically identified peripheral artery disease and heart failure as areas of particular focus, meaning that peripheral artery disease has this high burden of symptoms, profound impact on quality of life, and there are documented disparities in access and receipt of high quality care, and that rigorous comparative effectiveness research could actually help think about the best treatments for patients, avoiding amputation, improving their functional status, those outcomes that are important to patient. And heart failure is on the other end of the spectrum, really, where the field's just recently exploded in recent years with lots of pharmacological and technological device-based interventions, but we recognize they're implemented in less than 25% or fewer of patients. And so that opportunity there to really close those equity gaps is pretty prevalent. And if you move upstream to the left-hand side of the slide, the other things that a lot of PCORI stakeholders have reiterated with us is the need for more CER to guide primary and even primordial prevention, and non-pharmacological approaches to things like obesity have been a very common theme. And there have been a lot of other opportunities for us to think about how we get upstream earlier to prevent cardiovascular disease. And looking at the middle of the slide, you see the systems types of interventions that we've been hearing, the system level interventions to think about detection of risk factors or to systematically reduce disparities in screening for cardiovascular disease. So we're excited to see what we can do to really utilize PCORNet and other tools, as well as to shape funding opportunities that will help to deal with some of these challenges that have been identified over the last year or so with our stakeholders. So I'm just going to wrap up now and talk about, as we look forward to the future of comparative clinical effectiveness research in our evolving health and healthcare landscape and patient-centered learning healthcare, we have the opportunity to take those questions that are of relevance to patients, integrate clinical CER trials actually into clinical care, and leverage things like wearables and artificial intelligence and machine learning and technology to assess patient-reported and health outcomes in this continuous virtuous cycle that helps to accelerate translation and impact by engaging patients and relevant stakeholders, including clinicians and health policymakers in this work. And imagine if we can also embed in those approaches implementation science and implementation into the earliest thinking of our trial planning, and considering that uptake and sustainability of results really from the beginning. And I want you to just imagine a day with me when most of the patients that are prescribed a new therapeutic or device, where there may not be evidence of superiority or non-inferiority, there's clear equipoise there, are randomized to relevant comparative strategies, when patient-reported and health outcomes are collected routinely and digitally recorded for future analysis, and they're done efficiently and regularly, and when patients and providers and policymakers have equal access to the evidence to make informed choices, recommendations, and policy, regardless of who the patient is or where they live or their socioeconomic circumstances. That's the opportunity we see at PCORI and what we see for the future. And we can't do that alone. It takes all of us together to really seize these types of opportunities. So I'm excited about our future, and I'm excited about the future that involves the collaboration with all of you. So thank you so much for having me here today, and I'm looking forward to your questions and comments.
Moderator on. So I'm going to see if there are any questions online, but if there are folks who want questions.
Yeah, first of all, phenomenal talk, and I'm so appreciative of you spending the time with us and the dinner last night and here with us this morning. It's just reflecting when we were speaking before this meeting on the many ways we've intersected over the last decade and a half in different roles. I couldn't even remember which roles they were because it just reaffirms what Harlan said, the impact you've had in our cardiovascular science infrastructure and the impact you're making. And it's so exciting to see you in PCORI now. My question is really focused on, you've given me a lot of ideas. You might be getting some applications from all of us in cardiovascular medicine. So I won't go into those specifically, but I want to ask you, in your role now, how do you see, what do you see as the challenges as well as the processes to move forward to integrate US resources focused on healthcare research? For example, how does PCORI you see intersecting with NCATS, and how do these different streams of funding hopefully move us forward towards your goal that you said in your last slide?
I really love that question, and thank you for your kind comments. It has been fun to interact over the years. And we have, I think, a niche in that larger research ecosystem where we're kind of on that latter end of the translation spectrum, right? There's a lot of that more formative fundamental discovery science, the efficacy work, a lot of the generation of platforms and things of that nature that may be in that NIH funded opportunity. And then PCORI is really interested in comparing things that may be effective strategies, doing that in the real world and thinking about how we leverage the data, technology, et cetera, that will really enhance that cycle that we talked about. And so it takes us collaborating from the very beginning, right? In terms of making sure that we're thinking about those issues, how we're thinking about that whole pipeline and spectrum. And we do a lot of that. We have the opportunity to have the NIH director or designee, as well as the AHRQ director or designee on our board of governors. And part of that focuses on collaborative opportunities. We formed work groups across the organizations in order to talk about priorities and where we're going and thinking about what upstream work may be informative for what we're doing downstream. And we had a lot of those conversations around strategic planning because AHRQ was developing their strategic plan at a similar time we were, and several NIH institutes that intersect with us. We discuss those types of opportunities on a regular basis. So I think there's a fortunate component of PCORI being publicly funded that provides that entree to relate to other public funders in a way that we think about the research ecosystem more broadly.
Thank you, Nikala. That was a wonderful talk. And I'm going to take advantage of being between our health system leaders here, which is to say that a lot of research that does try to advance the uptake of evidence-based medicine or implementation really relies on it existing within the ecosystem of a health system, a business, and in the community, which are non-research entities. And so how do you drive forward research within a learning health system that is that's considerate of what's at stake for health systems and the support that we need in order to do that research, but that doesn't actually come through the research dollars? How do you do that?
Well, it's very interesting that you raised that because I don't think I have a straightforward answer, and that's part of what we're trying to do to learn. And one of the reasons that for even the initiative I mentioned that's in partnership with AHRQ, where we are now embedding research within health systems through this funding opportunity, is about learning how to bridge between the health system and the research enterprise in a way that actually benefits the health system and the patients that it serves, right? And so understanding those benefits similar to the way we understand with other stakeholders like patients, what is it that's important to the health system? And how do we then think about the research and collaboration with the health system in a multi-stakeholder approach is one model that we're considering in that initiative. And the other one that I mentioned, just to kind of talk a little bit more about implementation, is the one that has the health systems as partners in order to identify the areas of most importance to them, and then working on the implementation of research results. But what we anticipate is that's going to generate questions that then actually become the basis of the type of research that a health system and its community that's broadly benefited by the health system start to identify as areas of importance. And so we believe that utilizing that engagement approach, that multi-stakeholder research approach, is part of how we bring all parties to the table in order to conduct the research that's most important to everyone involved. And so that's really what we hope to find, but we've created learning networks on top of these programs to really inform how we may learn what's working and not working and adapt our approaches down the line.
That was an excellent talk. I mean, there was so many important points. As an early career investigator, it's important for me to like appreciate what everybody else is looking at as the pie in the sky. The key question for me, and that kind of was emphasized on several sides, that there are key institutions that have led important innovations in science. How do we balance that? So say 40 centers are part of this health network and are engaging in evidence generation, but the implementation has to disseminate to 4,000 hospitals. And how do we go from those institutions that participate actively in evidence generation, that tend to be the same institutions frequently because of their academic prowess, to those who actually deliver care to the majority of the population?
I think that's wonderful. And one of the things that we're excited about is the overlap between the two. So we actually have health systems in PCORNet that are also participating in the Health Systems Implementation Initiative. And that's exactly one of the learning questions that we've identified as important to understand how to bridge the evidence generation to implementation gap in a health system. And so there's a subset of about a third of the Health Systems Implementation Initiative sites that are part of the evidence generation component within PCORNet. So I think that's going to be a critical component in terms of learning. And, you know, many of my answers, as you'll recognize, are about learning. Because one of the things we're trying to do is really have the eyes and ears to understand where the interests are and how we actually bridge different priorities in order to think about what I mentioned before, is that challenge of doing this type of work in a stakeholder engaged approach. And so this is something that we'll all have to navigate together.
So, sure. Thank you so much for joining us this morning. I was struck by as you were giving the talk, that in many of the initiatives that we are working towards, we're looking at the end results of diseases that take many years to actually evolve. And spending some time actually in the neighborhoods of New Haven, one gets a great sense of at times the overwhelming issues that surround the social disparities and health inequities. Is there an opportunity to think about putting together initiatives that are much more upstream of identifying populations at risk at a very early age and thinking about interdictions from a research perspective, that we can put together a plan of action that looks to have an intervention that actually ultimately decreases the chance of heart failure, or decreases the chance of the deleterious effects of hypertension, for example?
Absolutely. And you would be, I think, echoing the voice of many that we've heard when we started a lot of this engagement around, for example, the cardiovascular health topic theme, that concept of how does PCORI start to move more upstream and start to think about those opportunities that may not necessarily be directly delivered in a clinical setting, right? And a lot of our work has been focused in the past in that clinical setting, but how do we integrate the work that actually is going to be important for all the factors that are driving health, which are where people live, work, learn, and play, and trying to understand the interventions in that context. There's something that we've done to start to understand the state of the evidence in that space. We've put together an evidence map of all the social needs interventions and the types of studies and trials and what we've learned from them, as almost a platform to be able to have these discussions with stakeholders and others. And that evidence map is actually available on our public website. It's clickable, interactive, et cetera. There were a subset of CER studies within that as well that we're starting to learn from to think about what may be right for PCORI opportunities. So we have a mind meld in terms of the opportunities there and are actively exploring them. I'll also mention that, you know, part of the stakeholder community I didn't really emphasize here are purchasers, payers, and others, and they're very interested in these exact same types of interventions as well.
Yeah, that was a wonderful talk, and the impact of your work obviously is unlimited. You mentioned some key terms: engagement, dissemination, health communication. One of the obvious major challenges in providing the highest level of care in the communities is health illiteracy, which is not a term I love, but just are there initiatives that are directed at getting research results and health information into patients in the community at an early point in time so that it becomes part of the foundation of how people think about their own health?
I actually love that question too. And there is a component of what we're focused on in our engagement awards that exactly reflects what you're speaking to. So our engagement awards have a dissemination and implementation opportunity, which are really about opportunities where community-based organizations or researchers that have worked in certain spaces with the community or with patient partners or community brokers can then take that opportunity to talk about research results in a way that it can garner more uptake through convenings, through the type of funding that doesn't typically come from a research funder, but helps to really support what's necessary for the research results to be understood in the communities by the patient organizations, et cetera. But what's really important about that is that it often helps to generate the next research agenda that may be really important for that community or patient group, et cetera. And so we find that our dissemination and implementation engagement awards are also research agenda promoting for us, because we learn what some of the stakeholders that we're trying to reach are really interested in PCORI taking on as research opportunities. And then we further that by saying, well, if there is a component there that that community or group is interested in pursuing further for capacity building to be engaged in research, then there's another type of award that can support that as well. So we call that kind of research related because it surrounds the ability for all of the research we fund to have an impact. And that we think is a critical component to actually put funding in.
So I enjoy your talk very much. Question, and I hope you like this one too. I'm actually a basic scientist. So the question you mentioned about the precision medicine. And one area I want to ask you if you guys are interested in funding is the pharmacogenomics. And as you know, there are a lot of drugs, actually, as you mentioned, there are GLP-1 agonists in shortage. People are taking it, even people with diabetes don't have access to it. And actually, if you look at genomics data, I mean, large data, which doesn't actually include Blacks or Hispanics, is actually GLP-1 receptor is actually more polymorphism is one of the most strongest signals for obesity, diabetes, cardiovascular disease. And the question is that who benefits most? So kind of looking at, studies that actually going to look at pharmacogenomic and see people with genetic variants, how the response is, and focus on those population, including Blacks and Hispanic in those studies. It's something that you guys can focus on for funding, because it's very important. I mean, question, right?
It really is an important question. And, we probably don't fund as much in that kind of early generative research space that is trying to understand the fundamental biology of that type of pharmacogenomics type work. But we would fund things like strategies. So for example, if you were trying to take a pharmacogenomic strategy that may have already been shown to have some efficacy in some way or another and compare it with perhaps a non-pharmacogenomic strategy or things of that nature. So it's the comparative work of interventions that have already been in some way proven to be efficacious or in widespread use in the clinic, et cetera. So if we were already using GLP-1 pharmacogenomics in the clinic, and we were trying to see if that's the best in this population under the circumstances, et cetera, as compared to someone. Does that help in teasing it out? Yeah. And I did like your question. Thank you. Thank you so much.